And welcome to our presentation on Bridging the Gap Culturally Responsive Data Collection for Limited English Proficient Clients. Um, for those that don't know me, my name is David Loaiza, President and CEO of Diversidad, consultant on language services, and a little bit about my background. I specialize in the medical field. I have a master's in healthcare administration, and I've had over 20, well, over 12 years in administration of language access, but over 20 years in the medical field when it comes to language and inclusion. And I've worked with different companies, from hospitals to clinics and non-for-profits on expanding language access. So like I said at the beginning, any questions that you have, anything that you want to expand as we move forward, please don't hesitate to type them in the chat box. Part of my background as well is having a black belt in Lean Six Sigma, nothing to do with martial arts, but more on quality improvement processes and project management. And that's why I put this at the beginning, because a lot of these presentations that I bring, I do it keeping in mind of a methodology, which is the DMAKE methodology: define, measure, analyze, improve, and control. And it is a wheel, just like the PDSA that most of you guys are familiar: plan, do, study, and act or adjust. And it's something that you just continue on improvement. So previous presentations, we have talked about defining what we are here for, demographics, which I'll do a little overview at the beginning of the presentation, how to measure. Here, we're going to emphasize more on analyzing and continue improvement. So if we looked at our demographics as a whole, worldwide, based on volume of languages that are spoken, English is going to come up as number one. This is actually from data collected from a website that just specializes on language and volume. Obviously, some of this data go up and down, but this is just to get an idea of languages that are spoken out there. So depending on what your needs are and how you are targeting the population, this might be a beneficial data for you to know, uh, especially if your services are worldwide. So just keep in mind English, over a billion, then as well as Mandarin for Chinese. And then we have other ones, Hindi, Spanish, French, Arabic, and so forth. And this is just a picture of language per volume. When we narrow it down to language per state, not even the United States, but just the actual state, which is what we're here for, we looked at the Nevada demographics based on the census 2020, the latest census data that we have. And this is what we come up on alphabetical order: American Sign Language, Amharic for Ethiopian, Arabic, Chinese, doesn't specify which Chinese. Most likely it's going to be Mandarin, uh, Farsi, Filipino, most likely it's going to be Tagalog, Korean, Spanish, and Vietnamese. These are going to be your top 10 languages other than English, uh, or including English, and for our census community. So again, if your organization tries to provide information for everybody based on demographics, then this is going to be your important data to look at. And if we look at demographics that we presented last time based on specific the specific organization demographics, and this is just an example. If you collect the data based on requests, this is how it's going to highlight, and you can see that some of the languages per the state are going to be displayed there. Um, well, apologize. I think I'm missing a slide here. But if we look at Clark County data, so out of this Nevada demographics, if we look at the Clark County data, we have Spanish at 23%. European languages come up to be like close to 3%. Then we have Asian and Pacific Islander languages at 7-ish percent, and other languages, which if we look at uh, Las Vegas, like as I mentioned before, we are one of those high touristic destinations, and also popular for migration, especially with the economy compared to other states that have the income tax or the state tax. Then we get a lot of migration here from everywhere in the world. We get a lot of visitors from everywhere in the world. So that's also something that we need to keep in mind, because if we look at data from visitors, then we get like a million visitors a month, and that's from everywhere. So obviously, we're gonna have a lot of languages. Now, what kind of languages should I be providing, or can I get somebody that provides all the languages? Keep in mind that there are over 7,000 languages out there. So usually when we get a huge vendor that can provide a lot of languages, they're gonna try to give you the most common 200 languages. And obviously what you want to look at is the languages that kind of appear on the screen for just for idea purposes. When we look at analyzing the data, what does this mean for my organization? We, again, depends on what you do for your organization, then it would be ideal to provide access to those that speak other languages. If you are gonna look at access data based on my previous experience, um, healthcare industry, it has been told nationwide, multiple states, multiple hospitals have this understanding of like when a language succeeds 10%, 15%, then we need to provide written material for that language. That's kind of it's not a law, but it is kind of like a, a rule or a norm to have in mind so you can provide better services. So in the case of and this was like in other areas where it was not as touristic, other states, but looking at this state that is very touristic, when I was in the hospital setting, I would say, well, if the language surpasses 5%, that's when we need to start translating documentation, consent forms, important, what we call vital documents. So anything that we need to provide that is going to impact the person's well-being, whether it's health-wise or immigration status, legal, something legal, then we need to provide that information in a bilingual format, uh, and, uh, and have it available, have it ready. So that's when understanding culture becomes important. So cultural competency, we have mentioned these two words in the past. Cultural competency is the ability to understand, appreciate, and interact with people from cultures or belief systems different from your own. In the context of data collection, it means recognizing and respecting the cultural factors that may influence how individuals understand and respond to questions. So just to give you an example, imagine that you are distributing a survey and asking about mental health in your survey. In some cultures, talking about mental health, it is openly stigmatized. They don't nobody wants to be called crazy, or if they say that they have seen a psychologist, it's like, oh, I'm just admitting that I'm crazy. So uh, it's a different perspective, and sometimes we have to reword the questions in a way that we can get better answers or open answers. And so keeping that in mind, how you phrase some of the questions is important when it comes to culture, when it comes to language. Sometimes a lot of translations are very literal. So try to avoid in your main template, your English format, trying to avoid, or better said, try to think of literacy levels. So keep it at a nice, I think the standard nowadays is fourth grade level. And it's something that is understandable. Avoid high jargon or high registry, specific words that may not get translated uh, accurately. So, and I just realized my camera is over here, so just don't want to block any of the letters. So having awareness of the cultural differences that you are serving, it is important. Like I said, it goes beyond translation. So it is important to have the translation materials available if it is something that you guys get a lot of different community, different languages come into for your services, and you want to the ideal is to provide good understanding so you can provide the service. And when we talk about beyond translation, it's not just the words that are being translated, but it comes to how we interact, how we talk to the person, how we ask the questions. So just to give you an example, direct eye contact is one of the big aspects of um, culture. So when I was growing up, and I grew up in South America, I was told you maintain eye contact, and every a few seconds, you kind of like look away or look at something else, then you go back, and that doesn't make the person uncomfortable. Here we are used to making eye contact, smile when we're having a conversation, but in some other cultures, and if you guys come from different cultures, please feel free to give us some examples that you have experienced, or whether it's within your culture or other cultures that come uh, to your organization or that you have experienced while traveling. But in multiple cultures or other cultures that are non-Western cultures, the eye contact experience could be disrespectful. If you like look at the person, might be like, oh, I'm better than you type of thing. It might be kind of like I have more power if I'm looking at you straight. So uh, there is uh, there are cultures that they teach children not to look at the elder, uh, like in the eye, or try to avoid some of the eye contact. Um, just realized that I have my white screen. So if you have any questions and somebody says that, feel free to jump in. Otherwise, we'll just save it for the end because I don't see the chat box. So yeah, so cultural eye contact. Um, the significance of data collection. So when we talk about data collection, and gotta keep in mind some of the risk of ignoring the data collection and the cultural aspects of it. But like I said, keep it simple. Uh, avoid idioms, jargon, phrases that you think it might be ideal to use or kind of cute, kind of like get the ball rolling to get started. Those kind of phrases should be, or idiomatic expressions should be avoided. And neglecting cultural context can lead to misinterpretation. Uh, it could also be biased data. And if we have data that we are not really looking into in a specific set of eyes per se, then we're going to start creating ineffective programs. So give you an example also in the healthcare industry when we talk about diet. That word itself, diet, is kind of should be sometimes rephrased to the way of eating, because a lot of people, when they talk about dieting or diets, they think about immediately culturally weight loss. So like, what's your diet? Oh no, I'm not dieting. And I know here also in English might also have that perception sometimes, but you know, we try not to generalize every single culture. A lot of the times, people see that I speak Spanish, that I'm Hispanic, so they're like, "Oh, you must eat a lot of spicy food." And I grew up in a culture that spicy food is not the norm. And I think Mexico is one of the few places where you can actually uh, eat the spicy food. So, and because Mexico is so close to the U.S., everything is generalized to all the Latinos, to the Mexican culture. So uh, yeah, food is one of those things. Oh, you must eat like a lot of rice and beans. Like no, like I do eat a lot of rice with everything, even spaghetti and rice. Well, used to. Now I'm getting healthier, but I grew up that way. Like it was, rice for lunch, rice for dinner, with whatever it was. Some sort of meat, some sort of grain, not necessarily beans, but lentils, garbanzos. I just got modified, different type of meats, chicken, pork, beef, and there is a lot of seasoning, but not spicy seasoning. And also uh, like if you travel to some of the countries, like in Colombia, I grew up in Colombia, there are gonna be some cultures that they have for breakfast soup. And to me, that was weird, but there were some regions in the country that, because of the high altitude, being cold, that was kind of the norm. And to me, a breakfast was kind of like, black coffee or some sort of coffee and a piece of carbs, bread. Uh, and it wasn't until I moved to the States that I started eating more eggs. And that's also what happens with a lot of cultures. Like the following generation, the younger generation is going to be more acculturized to our norms. And that's where we get better at understanding the issues that we have with the eye contact or proximity. Those are going to be with the new generation. Those kind of removed are kind of improved in a way based on what we are used to. One of the things that I experienced in the healthcare industry was, and again, I'm not generalizing, but we did have some individuals that the culture was more patriarchal, meaning the man of the house was the head of the household, the one that should be looked up to give the answers. So in the medical setting, again, when there was a delivery and the not mother baby, labor and delivery unit in the hospital, questions are asked to the mom. Are you diabetic? What's your diet like? Do you have some prenatal care? There were some patients that would like turn and look at their husband like, can you answer for me? And that was just part of their culture. Obviously, there are some initiatives that we can do as providers, kind of empowering, and more than empowering is educating the reason why we do things. And in this case, the reason of communicating with the mom directly instead of having somebody to respond for them is to reduce some of the issues in communication, to empower them to uh, take care of their own health. And so data collection, it's got to be also specific to, the community that you serve. I've had some organizations that say, well, you know what, we're like 95% or 99% his Spanish speaking. So like, why would I need all this data on other languages? And so if your not-for-profit organization delivers some sort of service to Spanish speaking or uh, Asian communities or African communities specific, then if it is the same language, I would say look for more data. There's always going to be data for improvement. And in the case for all Spanish, the data would be based on uh, location of birth. So where are you from? So it could be country of origin, or it could be, if it's country of origin, it could be more specific to if it's a indigenous tribe, or just to get more specific. The reason is because language is also impacted based on region. So even though we all speak Spanish in multiple countries, doesn't mean that, kind of like in English, like we have a different English speaking countries, but there's going to be things that are said different way. And what we want to do is accommodate and also fix the verbiage on the documents that we're providing, the information that we're providing to the biggest community that we're offering. So translation services, for instance, it has always been targeted to the Mexican community, because when we look at demographics, and this is in the States, United States as a whole, when we look at demographics, the country of origin for Spanish speakers is going to be Mexico, just based on proximity. It's the country closest to us. So a lot of the things when we look at, how do you say, especially when it comes to food, then there are words that are changed from country to country, like popcorn. There is a different word for every country. A straw, there's a different word for every country. So when we look at that, we want to utilize like 2 or 3 words in the translation instead of, so make sure that post procedure you start using a straw, or if you are uh, an environmental company that try to promote uh, the use of eco-friendly products, and straw is one of those, like let's not use plastic straws. So the word is straw, we're going to use the word from Mexico, popote, and then we're going to use probably the 2 other common ways to say it in other countries, pajilla, pitillo. So it's going to have, like, even though it's one word straw, we might accommodate 3 words there to make sure that there is a better understanding on the message based on the community, especially here in Nevada, that we do have huge communities coming from other countries, everywhere in the Latin American, when it comes to Spanish. So optimizing some of the data, we talked about this last session. So a lot of the times you guys may collect data based on surveys. We talked about the use of your website, and like activating those ads, or not ads, apps for translation. And there is a way for you to collect how people visit the website and what kind of languages are collecting or translating everything. And all of that is useful for us to find out what the type of data that we are promoting or using, well, the type of language that we're using, and how we need to modify it or have more services available. Brainstorming sessions. And this could be with inside clients, your front desk staff, or with your community. So if you have town hall sessions, that's going to be more qualitative data. Those sessions where you sit down and talk to people, surveys. If they're open-ending questions on the surveys, how do you like our services? Give us some feedback. Those may have to be analyzed by somebody that it's cultural expert. So we call those cultural brokers. And cultural brokers are individuals who are trusted members of a particular cultural community and possess in-depth knowledge of its values, beliefs, and practices. They serve as a bridge between researchers and the community, ensuring the data collection is conducted in a culturally sensitive and meaningful way. When you use cultural brokers, uh, you if you're using somebody that is bilingual in your staff, they will be the cultural broker. They kind of understand the not just the language, but the culture. So they will be the ones that will be taking it a little um, a step further than would be just anybody. Like if you have a specific statistics employee and they collect data and they analyze it, they might not see some things that the cultural broker might see in the data. And like I said, it also depends on the data that you are collecting. So as a lot of the times when we use bilingual staff, when we use interpreters, uh, whether they're on site or over the phone, video, these individuals may act as cultural brokers. I know that from the legal aspects, when you have an interpreter in the courts, that cultural broker is not as big as, and it may not be there at all, as the one that is from the medical. And I might explain this more in the next presentation next month. But when we teach methods of interpreting, when we get somebody that is bilingual and try to get them in the professional environment of how to do it accurately, the main thing is what you guys know that is called the conduit, where somebody provides word translation. They get the message, they give the message. They're serving as a conduit. That's like 80% of the time, or 70% of the time. And there is another aspect called the clarifier, which is there might be some sort of word that I'm not familiar with. It could be generational or could be geographical. So like I said, the word straw may be multiple words depending on which country, and it might have a different meaning from country to country. So to clarify what they're actually saying, the interpreter should say, "This is the interpreter speaking. What do you mean by this word?" Uh, I know that now we have a new generation coming up with new words. I have two young kids, and I hear some of these words a lot, like, "Oh, you're so sass," or "You're so sigma," and those are also words that uh, if you don't have kids or you're not exposed to the kids, you may be like, "What are you talking about? What did you just say?" Uh, so uh, so yeah, we need to we have somebody that is not just bilingual, but can help us with the cultural aspects. So the person will be doing the message, will be also clarifying. That's another big portion of being trained interpreter. And there is the cultural broker. That's also a big portion of being an interpreter. And that's what kind of we're talking here about being the cultural broker. If there is, I know there has been in healthcare, word cancer. The word cancer, cannot be spoken in some cultures. If you say that I have cancer, even if I have it, that's going to be devastated. it's gonna kill me because you kind of put in some bad energy towards it. The word cancer is taboo. So there might be some cultural things that might be accommodated. Uh, I know that there is the doctors have also a different culture. The healthcare is a different culture. And based on malpractices, based on issues that has gone in the past, the doctor has to let the patient know everything that is going on, regardless of the cultural aspect, so they can make their own decisions. It's not, we have other countries that the patient is used to having the doctor make the decisions. Here in the United States, the culture is you make your own decisions about your well-being, about your health, and you kind of so that also changes. A different type of culture, not just geographical, but also, or it's somewhat geographical, but it's also based on something that we have experienced. Like the legal system might not be the same, the healthcare system might not be the same. So that's where education comes in. And cultural brokers might be able to say, um, well, the person grew up in a ranch or a farm. There's no technology. They're not familiar with what a fridge is. They're not familiar with what this type of devices. So there might be some um, better communication. A lot of the times when we use an interpreter and they're doing a great job, they're communicating. A lot of the times we have the patient or the provider, the patient, the client or customer, just nodding. And it's like, oh, you're fully understanding what I'm saying. Best thing to do is to, you know, uh, hopefully you understood what I said. Could you repeat back? Use the repeat back method. But cultural brokers bring a lot into it. There is like in roles of the interpreter, there is the cultural broker. It's kind of like 10% of what they do. There is another one that is very small, which is the advocate. Interpreters are not advocates, but if it's going to impact the person's well-being, if there is something that may be mistranslated or something that is cultural, then they might advocate for the client by educating. So that advocate part of it may not be seen in some other areas. It could definitely be seen in the community interpreting world, uh, especially the cultural broker, the advocate role. Those might be slightly bigger than in some of the other areas like legal and healthcare. And I'll expand more on those next month, next session. There were some questions based on our last survey. Here I pulled out 4 or just a few questions that came up from the last survey that I wanted to incorporate on this presentation. That's why I said don't be afraid to. Please type something in the chat box if you have any concerns, any things that you want to expand on. Strategies for dual language employee recruitment. People also want to know about what is there for the deaf community or the blind community, people that are hard of hearing, and something that I touched base about, like if I don't serve the whole uh, county or the whole state, if I have a specific niche, if I have a specific target population, how do I know how to expand onto other um, languages? And the last one is kind of similar to number 2, which is like what is there for deaf and hard of hearing. So let's start with the strategies for dual language employee recruitment. So 1 second. All right. So number 1, highlight bilingualism in the job description. So obviously, when you're recruiting, when you're getting new staff, if you include the words fluent in Spanish and English, proficient in written and spoken Mandarin, Cantonese, Filipino, then that might give you a bigger pool of people to interview. Also, when it comes to uh, recruiting, we need to look at where we're posting our jobs. I know a lot of websites are out there where are very inclusive, and uh, I'm not going to be promoting some of the websites, but when you do partner with different institutions, like if you want to recruit somebody from a specific type of community or specific language, then we need to look at the Chamber of Commerce. We need to look at partner up with different Chamber of Commerce, Latin Chamber of Commerce, the Asian Community Resource Center, the anything that is specific to the population that you kind of want to recruit from. The reason is because there is a lot of Facebook groups, there is web pages, there might be um, newspapers, there might be, especially social media nowadays, is very inclusive. So just by targeting different job boards, you might be able to get a bigger population. Yeah, social media. Also explain how these skills will be used in the role and highlight their importance in serving your clientele. For example, if you're trying to hire somebody to speak Spanish, you might say you will use your Spanish language skills to communicate with clients, translate documents, and provide culturally sensitive services. Obviously, if you're having somebody to do things that are that high, you need to make sure that that person is not overqualified, but very well qualified to do that. So in order to make sure that the person is proficient, a lot of the testing sites, when it comes to interpreters or language related, there is a certificate on language proficiency, or if they're gonna take it a further step, if they have taken some sort of training that requires the language proficiency as a basic documentation to get in the program, then that's kind of like taking it a little farther. So if the person has some sort of certificate in some sort of interpreting or language, that kind of like gives them proof on some education, some training that they have done in the past. And so yeah, hiring practices, partner up with community agencies that are very inclusive or that they're culturally specific, and make sure that you have a workplace that's welcome different resources, different groups, mentorship groups. Like I've mentioned in the past, Nevada is a minority majority state. We do have very diverse communities in the different colleges and universities. So creating also some sort of internship program to educate people in specific segments on the college students that are about to graduate, whether if we talk about community work, those that are in the social work field, nursing, if you create some sort of internship programs that might give them exposure, and uh, also you might get some better perspective ideas on using them as cultural brokers, especially if they're well diverse in a community that you're trying to target. So in regards to that question on how can we improve our services to promote for the deaf community, the hard of hearing community, blind, or anybody with disability. again, number one will be partnering up with different companies that offer some sort of assistance. United Way is also always a good company that will give you information. If they cannot provide the service, they will actually have that information on or contact that they might be able to introduce you to when it comes to uh, spoken languages or American Sign Language or some of the local non-for-profits that might help with this specific type of community. So there now, how do I know? How do I create data? Or I think as a whole, we need to provide inclusive services. And obviously, when we talk about language proficiency, language access, we usually talk about spoken languages. And to get data from spoken languages, we can partner up with a vendor. If we use over the phone services, we can look at minutes, we can look at frequency. Coming from a administration background, I obviously trying to stay in the budget, trying to create programs that are beneficial for the community, beneficial for my company, the company that I'm serving. It's something that we need to put those pieces together on how to do that. And obviously, I'm not gonna say go ahead and hire a specific language interpreter, and then you get that interpreter. So let's talk about American Sign Language and Spanish. So you get an American Sign Language and Spanish interpreter, and you have them on staff, and you use them a lot. But there's gonna be days, times that you might not have anything for them to do. So that's where the data comes useful. So if you had some sort of trend on specific days of the week, specific hours where you're utilizing the language more, then you need to think on whether it is better to hire somebody or continue using contracting services. For the most part, contracting services are great. When you get a vendor that provides this type of languages, we have some great vendors here in town. Also, there are some great vendors nationwide that provide language access remotely. So partnering up with them is great because if you don't use them, it's not going to cost you. It's not a membership program. If you use them, then you can get that data and analyze when you actually uh, using the most. For hospitals in the community, when I was in the hospital setting, uh, we did have a lot of demand for multiple languages, averaging about 60 languages per month. And obviously, I could see which ones were the highest. Spanish being like 80%, and then some of the Chinese languages, Asian languages, Chinese, Mandarin, Cantonese were up there on the top as well. So that's when I said, okay, we need to have everything bilingual for English, Spanish. Some of the forms were created one side English, the other side Spanish. When it comes to consent forms, provider signs the side that they can actually understand what they're signing. Patients signs the other side because that's the part that they're understanding. So the page was kept. Both sides were signed. Now with electronic health records, everything gets scanned. It gets signature and understanding was there. There's gotta be also uh, some sort of documentation that an interpreter was used. When do I use an interpreter? Well, first question is, what's your language of preference? If you use what's your primary language, I mentioned that before, that kind of creates an issue because some people are bilingual, and even though they put in their primary language as their mother language or the first language that they learn, it does not really reflect the language that they need because some people might say, oh, Spanish, my primary language, and or Mandarin is my primary language. what happens is that it was their primary language as their first language, but when they moved to the States, they started going to college. Now their vocabulary is more advanced in English. So when having some conversations, it might be actually be better to do it in English. So language of preference, when talking about delicate subjects, if you want to expand that, then you might get a better and accurate data that tells you, okay, this is actually when I need to get an interpreter. So I remember times that I would go in and just because the person looked Hispanic and I was the Spanish interpreter, they were like, what? And this was in North Carolina. So they were like, what? I, I'm not Mexican. I'm not Latino. I'm Cherokee, Native American. So it's a lot of times if we don't train the front desk staff, just by the look of it or the last name, we have a lot of here in the community, a lot of Filipino community that a lot of names are Spanish based. So just by looking at the name, oh, we have here uh, some Spanish names like, okay, let's get the Spanish interpreter. The Spanish interpreter gets there or it's on the phone and it's like, no, they speak Tagalog or no, they speak Portuguese. So just, being open. A lot of the times it's kind of, I understand that when collecting data, it's difficult to ask somebody just in a way that we're not offending the person. For example, if I said, do you speak English? That might come up in a different way than I'm intended to do it. So a lot of the times when you do intake forms, now with technology, iPads are available, people check in the box. It is better for me to check in the box myself in a box when I'm just doing it. A lot of the times I see companies that they do have everything in English, very pretty and everything. Uh, if you are selling some sort of service or you are some sort of building for tourism where you actually have people coming, I would say don't be afraid to, or not be afraid, but think about different forms that you can be language inclusive. So one of the things that I said on the posters is make sure that you start including a QR code. During COVID times, a lot of hospitals went to QR code for menus. I know that people didn't like that, but a lot of people do have phones nowadays where they can scan a QR code and you can actually provide the same type of information on a QR code where they can select the language and go into that language and get better information. So don't want to run out of time. Speaking of QR codes, here is a QR code. Please scan it. Give us some feedback on things that you want to hear next presentation. And I'm going to go to the chat room to see what you guys are asking.
Thank you, David. If anyone has any questions, please feel free to unmute yourself and state your question, or you can go ahead and drop them on the chat box. In the meantime, I'm gonna go ahead and add my email to the chat box in case you want to reach out to me for any reason. As I mentioned earlier, we do provide free language access services, including translation, interpretation, and over the phone interpretation to local government agencies and local nonprofits. So please feel free to take advantage of those services. Aside from that, this workshop is going to be posted on YouTube and you can rewatch it at any time. David, is there anything else you would like to add?
No, I mean, I would say if also, oh, I just noticed that my microphone was off. So can you hear me?
Yes.
Okay.
Yeah, we were able to hear you the whole time.
Oh,
There's a
nice.
skip.
So I would say if there at any time, if you're watching this at a different time, the information is right there at the end, the last slide. If you have any questions, please reach out. Like I said before, every time that I get your feedback or specific questions, I want to customize the training to your needs. So feel free to say, hey, this is kind of the issue that we are encountering, and I'll try to plug it into the next presentation.
Great. Thank you, David. All right, seeing and hearing no questions. This gonna conclude our workshop for today. Again, thank you so much, David. Thank you all for attending our workshop today, and I'll see you all next month on our upcoming new workshop.